the question is bronchial incorporated per trachea? It's not defined. That's a very good question. It's not defined as such, but there is a principle in the MBS which talks about billing for a complete service. So the best example of that is that there are different item numbers, for example, for a needle aspiration of a pleural fluid and then an intercostal catheter and an intercostal catheter and drainage. And you can't bill all those three items just because you've done that procedure in the sequence. What you have done really is you've put in a chest drain and you've drained the effusion, and you can only use that one item number for it. Now, a bronchoscopy isn't necessarily a such a definite part of a tracheostomy, although it's more likely than not the standard of care and the expected standard of care if you're doing a trachea nowadays. I would suggest that if you only use the bronchoscope to visualize the needle and then to keep an eye on the dilation and you're not doing anything else, then really it just forms part of the tracheostomy procedure. If you actually end up doing a proper bronchoscopy and you do some washings and you send off specimens, I think that counts much more like a proper bronchoscopy. So you have to weigh this up. The way they look at these things, if it ever gets questioned, is they look at whether the service was required and whether the service was relevant to what was going on with the patient, and whether that fits the item definition. And I think it's hard to say that you've actually done a bronchoscopy if you've only put the bronchoscope down into the tube and you were looking at the needle going into the trachea. But if you've done a proper bronchoscopy and had a look around and did some therapeutic intervention or diagnostic intervention, then I think that's completely fair game. Ultrasound, again, is not defined, and for these things, so tracheostomies, chest drains, abdominal drains, lumbar punctures, pericardiocentesis, all those percutaneous things where you can potentially use ultrasound. It's not been banned, so you can use the item number for either the 55054, which is two-dimensional ultrasound, or any other ultrasound modality that you may use for those. But you have to be careful because if you've got vascular access items on the same invoice, the way Services Australia processes these is they've just got a blanket ban on all ultrasound if you have any vascular access. So you have to make sure that they're annotated, that they're not related to that particular service and which item you've used them with. Often it helps if you put times on there as well. I think these are the most tricky ones that bounce all the time.